So today we've got a group of different speakers, and I'll introduce those all in a moment. So just quickly get through some housekeeping and then introduce everybody else. So as I say, this session will be recorded today and we'll upload it onto our website afterwards. This just means we can share it around and ensure everyone else can get involved and hear what's been happening. As a result, please do keep your microphones on mute, and if you don't want to be seen, keep your cameras off as well. We will also turn the recording off at the end, so we can have a chance for a Q&A without having the recording there as well. So along with that, if you do have a question, please pop it in the chat function. Ms. Hallie will moderate that and bring it all up at the end. And as I say, we will have that time for the Q&A at the end, which will not be recorded, just to keep everyone's privacy there. So today, as I say, we've got a group of different people presenting. We've got Derek Munn, who's the Director of Policy and Public Affairs at RCSLT. He's going to have a quick chat about the importance of enhanced practice, the background to it, and why we are so keen to get moving with enhanced practice at the Royal College. We've also got Claire Adito, who's the Head of AHPs at NHS England. Claire's been really involved in leading this work from the get-go with enhanced practice, so it'd be great to have Claire's input as well. And then we've got Louise Henstock, who works at the University of Salford, and Dr. Kim Stewart, who works at Coventry University. They've been leading on all of this work with all the different professional bodies. So I think they know enhanced practice better than anybody now. So it'd be great for them to come along as well. And so I'm just about to pass over to Derek. Just wanted to say that today, as I say, we are just going into a bit of a deeper dive of what enhanced practice is, why it's so important, but also what the purpose of it is as well. As I said, now I'll pass over to Derek just to provide a little bit of information about enhanced practice from the Royal College perspective.
Thanks, Will. Thank you, everyone, for coming and welcome. Yeah, enhanced practice is one of those terms that's been around for a long time. And I guess it's also the case that sometimes there are things out there semantically that you know what they are, but they haven't been given a proper name. And I feel like there's a confluence here as the Director of Policy and Public Affairs for the Royal College of work that people do and experience and competence that people have alongside the term enhanced practice. And we know that the challenges we face around recruitment and retention, we know that those challenges focus on band 6 and 7 and are about the availability of proper career paths and career progressions and route to seniority and specialism and route to leadership. So in support of developing that proper career pathway, an enhanced level of practice to fill a gap where there is one, or to recognise a level of competence and expertise and development where there is one, we hope can make a difference to that career pathway, to that recruitment and to that retention. I'd like to thank Louise and Kim and the others who've been working on this. I am very much looking forward to myself hearing and learning. Thank you, Will.
Thank you very much, Derek. Thank you. So now what we'll do to start off with is just hand over to Claire, and Claire's going to give us a bit more of a chat from an NHS England perspective as well.
Yeah, thanks so much, Will. And I'm just really delighted to be here today and to hear from yourselves as well. I know we've got some question and answer time at the end, so we're really keen to hear from those of you on the call as well. Next slide, please. So we've been working in NHS England in this enhanced practice space really since about 2018, where we really started to focus in on this as a term, as a level of practice, and it's been evolving over the last few years, but more recently has been articulated quite well in the NHS long-term workforce plan, and ensuring you'll have all, I'm sure, heard about the long-term workforce plan and the fact that we're now moving towards a refresh of this plan. But it very clearly talks about enhanced practice as one of the levels of practice across the career trajectory, and how important it is to support the development and lifelong learning of our professionals in this space. Next slide, please. So we had an opportunity through the development of the Enhanced Clinical Practice Apprenticeship, which was approved for delivery in 2021, as a post-registration accredited route for development, to use this as a way in which we could support training and education at this level of practice. And one of the big levers for this has really been to use it within this space of accredited practice, because obviously we all know there's lots of CPD out there, but actually having accredited training and education that could support people in their mid-level careers. And it's sustainable because it's drawn down from the apprenticeship levy, and it means that employers can use this as a means by which they can support, as described previously, the retention, the training and the development and lifelong learning of individuals. So really important having this opportunity to use the apprenticeship levy, and also to think about ways in which we can use that levy in perhaps some of the less traditional routes for workforce training and education. And that's exactly what Louise and Kim will be describing for you today in terms of the speech and language therapy profession. Next slide, please. So really just wanted to be really clear about where we see enhanced practice sit. If you look at the career pathway right the way through from our support workforce through to our consultant level practitioners, what we're looking at here is the capability development, so that increasing complexity, increasing knowledge requirement, increasing decision making, and an enhanced practice really sits really nicely between the preceptorship and foundation level of the early years of post-registration qualification and between that and the advanced level of practice. It can stand alone as a career destination, or it can be a means by which people can move in and step towards a higher level of practice. So really clearly seen there, and I think we recognise now that this level of practice forms part of a large proportion of our workforce that are working as registrants. So it's a large number of colleagues working in this space. Next slide, please. So we've already done quite a lot of detailed work to help support delivery of the apprenticeship, and we've so far got 10 allied health professions where we've developed some schema to support the delivery, and which is basically a framework to support the delivery of the apprenticeship that's profession specific. And this webinar today will be talking to you more about the work that's been happening in the speech and language therapy space. We don't have schema yet that is published for speech and language therapy, but obviously this is really important work to us to make sure that as a professional grouping you are very much part of the work that we've been doing. Next slide, please. So the scheme that we've produced for 10 of the HP professions was really, I'm not going to go through this list, but you'll have these slides made available to you. It's really to make sure that the apprenticeship that's now up and running is very clearly aligned to each of the individual professions and their clinical need and for development and expertise alongside the other 4 pillars of practice. So we've got, obviously all 4 pillars of practice, but very clearly aligned to the clinical professional needs of each of those professions. So you can see there in that slide. Next slide, please. So I'm just going to ask for this little clip to be played. So I think we should have some sound. I can't hear the sound.
This.
Sure, again with sound.
Yeah,
If it's going to be a problem, don't worry, we can skip that one and move on to the next slide in the interest of us saving time.
really sorry about this. We're just getting there now. Okay.
Thank you. There's always bound to be a technical hitch, isn't there? Fantastic. So I'm not going to say much more today, but with the slides, you'll see plenty of links to information, further guidance, particular references that you might find helpful for those of you who are employers or individuals who are interested in the apprenticeship. So thanks very much and enjoy the rest of the session.
Thank you very much, Claire. There, as I say, there are a couple of slides here about sort of these additional support and guidance, which we will share with you after today as well. So now we're going to hand over to Kim and Louise to build upon what Claire's just said. Once again, thank you, Claire, and thank you, Kim and Louise.
Thank you, and thank you to everyone for joining us today. So Louise and I were two of the original commission leads from the development of the schema and model curriculars, and between Coventry and Salford University we led the development of 7 of the professions around the enhanced practice model curricula, and we're developing a further 2 with orthoptists and speech and language therapy. So you may have already been part of our workshops already, so we're here to give a bit more of a detail about the work we're doing and around enhanced practice. Next slide, please. So what we're going to walk through this afternoon with you is some key areas around enhanced level practice, what it means to you, what it means to your workforce, and we're taking an all nations perspective when we look at that. Whilst the original work was commissioned by NHSE, when we work with professional bodies, we recognise that this takes an all nations perspective as well. So we will be sharing information that is across all nations, not specific to England. We'll then highlight some of the work that enhanced practice can contribute around the retention of AHP workforce. And then Louise will discuss routes through enhanced practice through the apprenticeship and our work that we're doing with the professional body and you. Next slide, please. So what is enhanced practice? What are the key markers and hallmarks of an enhanced practice? So as Claire's already said, it's a level of practice that's already evident in our health and care workforce, but it hasn't really had a name or a situated understanding of it. So what we've been working through over the last few years is really helping to articulate and define this level of practice, and to then think about what the structure of professional development might look like that sits alongside that. Quite often when we hit that mid-career point of our profession, we can start to think about what is we want to do next, but how do we also develop in a structured way our knowledge, skills and attributes within our profession. So an enhanced level of practice, what we're really talking about is that this is a level of practice that is delivered by experienced registered practitioners who work with autonomy and independence in their clinical practice. They often work in situations where they are managing complex work, manage the day-to-day risk within their service and their sector, working with groups of people, and they can quite often manage the risk on behalf of themselves, the patients and the services they work with. Next slide, please. So when we started exploring enhanced level practice, there was a number of key documents across the nations that have started to really think collaboratively about what this level of practice reflects. So what we've done is we've brought that together to really understand the intersect between mastery and expertise that is profession specific. And I think when we think about this level of practice, it's really important to think about what is it that drives the profession specifically, really thinking about how do we make the best version of a speech and language therapist at this level of practice. The more secure we are in our profession specific thinking, as we move into those multi-professional roles and teams, it makes sure that we can deliver with impact and articulate the contribution that we bring into that sector. So across all nations, the common features of enhanced practice are about demonstrating profession-specific knowledge to support complex decision making. That's about also that clinical competence that comes with that knowledge and being able to articulate judgments that are profession specific within a particular specialty of practice. As our allied health professions, we are autonomous on birth, as Beverly Harden would say, but that's not the same for all professions. So it's really important we maximise that level of autonomy that we work with, thinking about our scope of practice. So working at an enhanced level recognises our existing autonomy, but it's about how we then use that to lead forward with our expert judgment within that profession-specific area of practice. And in doing so, it's about recognizing that criticality of thought and action. In other words, we can use and create evidence to inform our practice, both in how we think and how we act at that service level context. It's also about using those evaluative approaches where we are having to gather and interpret a range of data and information. And at an enhanced level, what we're looking at is being able to really use and analyse complex data in complex situations to inform our thinking and our action. And when we think about what this level of practice looks like in terms of leading and leadership, quite often what we're doing when we're working at this level of practice is becoming a situational leader and working when we maybe don't have authority or power to act through. So this is about really embodying those attributes of leadership, of advocating for others and working through influence, which is absolutely vital when we work in multi-professional teams and within our own profession as well. Next slide, please. So you've already heard from Claire, and I think what you might be seeing is that we are reinforcing these messages. We know the long-term plan is there in terms of how we are addressing our society's needs, but we also need a long-term plan for workforce that absolutely drives forward the knowledge, skills and expertise we need in order to enact our ambitions for care across health and social care. So enhanced practice is absolutely recognised in the long-term workforce plan, and whilst there will be revisions we're expecting, it's about really thinking about driving forward that retention of mid-career within our professions and ensuring in doing so we have access to structured professional development within our professions. Next slide, please. So again, you can see we can understand that enhanced practice sits between preceptorship and foundation and advanced level practice. And what we've really been focusing on all the work to do with enhanced practice is really thinking about how do we realise the fullest potential of the skill mix across all of our professions? What and how can working at an enhanced level really realise in terms of health and care delivery and quality when it comes to safe and effective care across the breadth of our professions, both in terms of all of those pillars of practice, but also in terms of how we retain staff as well. Next slide, please. So you've got the links to be able to access the full schema documents that have already been created. One of the recommendations from that schema of work was to really think about what are the routes through enhanced level practice, recognising if we take a Four Nations approach, apprenticeships really reside within an apprenticeship within England. However, what we wanted to be able to reflect is there are a variety of opportunities here in taking forward enhanced level practice. The recommendation of the existing schema is that this level of education is delivered at level 7, so equivalent to master's level education. We have also recognised that enhanced level practice can be delivered by a number of routes. It could be an apprenticeship if you're working in England, or it could be funded through CPD opportunities as well. And we know there is ongoing change around how we access funding in each of our nations to promote professional development. Within the apprenticeship route, it is a non-credit bearing apprenticeship standard. That means it isn't mandated academic awards. However, we understand this is an important part of that retention piece and of really thinking about why would somebody continue to progress in their development within their profession. So there is the option within the apprenticeship to not have academic credits, but it doesn't preclude where necessary to include academic credits as well. Our recommendation from the first schema is that would be equivalent to 60 credits of learning. So a postgraduate certificate is typically what most providers are offering. And when we come to CPD routes, again, it's about bringing out access to all groups of our workforce where maybe they are unable to draw down on an apprenticeship route. So again, that CPD route may be non-credit bearing or it may be credit bearing. What we really wanted to do was drive forward a professional development opportunity that was open and accessible to all professions and all sectors. Next slide, please. And I'm going to hand over to Louise.
Thanks, Kim. And I've just popped in the chat there, there's the link to the full profession specific curriculars that have already been landed across the 7 professions that we wrote and a couple of others from other providers. And also there I've just popped in the box the link to the Enhanced Clinical Practitioner Apprenticeship Standard. So as Claire and Kim have both said, apprenticeships are at the front of the workforce plan. And in terms of this specific apprenticeship, all apprentices must spend a minimum, it says an average of 18 months on, but it's a minimum of 12 months on the programme with a minimum of 20% off the job training. As Kim just said there from the flow diagram before of the optional routes through enhanced practice, it's a non-integrated EPA, and I've just put the endpoint assessment there in the link. The EPA consists of 2 discrete assessment methods, but it's non-integrated, and for those people who don't understand what that means it's not put into the programme. So yeah, we can answer any questions around this because we do appreciate that apprenticeships are still fairly new in AHP sector. So a non-integrated endpoint assessment means that it sits outside the programme. You would do the PG cert and then you would go on to the gateway to then do your endpoint assessment. And this particular endpoint assessment consists of 2 assessment methods. One is a quality improvement proposal report with a Q&A. And the second is a professional discussion that's underpinned by a portfolio of evidence. Next slide, please. In terms of the apprenticeship then, it should offer flexibility in how it's delivered and taken up. So the apprenticeship standard was not something that we were involved with. It was not within our remit to change. But it should give you flexibility looking at HEI providers and looking with employers about what that looks like for your profession. And the key driver around enhanced clinical practice is around that profession specificness. It's really important that we look as HEI providers and you from a clinical perspective to really drive the profession forward and really have that nuance of profession. Having said that, we do know that there are some sections across the workforce where you may get the crossover between professions, and it may be that it's along a similar pathway. The standard is designed to optimise that workforce and meet population health and patient care needs, and it runs across sectors and settings. It's across healthcare professions and wider, in actual fact, across specialities within clinical practice and across all models of service delivery. So there is no reason in whatever sector or pathway or specialist area that you are that this cannot apply to you. Next slide, please. So this is really sort of to get you up to speed with where our journey is in terms of the development of the enhanced practice schema and professional specific curricula, and where we're up to sort of now really with the Royal College of Speech and Language Therapy. So phase 1 in the journey of development was a joint commission and innovation partnership between Coventry University and the University of Salford, where we joined together and worked on this documentation to really sort of pin down and develop what was enhanced practice and what that looked like across the 7 professions there on the screen. And that really was almost like the phase 1 part of this. We've developed the document that's there in the chat for you, and the top end of the document is what we'd call the schema, and that's really the high-level principles of what enhanced practice is. There's underpinning things around that, around teaching and learning methods. There's a section on EDIB and how that should look in terms of enhanced level practice for recruitment, for HEIs, for employers, for making sure we have equity in enhanced practice CPD offering. And also then with each of those professions, there's a following subsection or chapter, if you like, that's really dedicated to that individual profession. And each of those are mapped to professional standards, it's mapped to the apprenticeship standard, but also to any frameworks that were in those professions themselves. And that might be professions frameworks that were already written, it might be at advanced practice level, and just sort of dovetailing in and making sure that was all mapped together for each of those professions. Next slide, please. Within each of those professions within the documentation, you'll see that it's written across each pillar of practice. So it's clearly demarcated, it's color-coded in actual fact for ease of reference, that the standard, the apprenticeship standard has been mapped across domains, and each of those domains has 3 levels of descriptors. So the high-level domains will go across professions. And then within each level of that, there is profession-specific descriptors. And when we were writing this, that has been written with the professional language that we all have, the nuances and the superpowers that we all have in our each individual professions that make it sort of really special to us. And then within each of those, Bev, NHS England, Bev Harden and Claire, when we did this piece of work, really asked us to pull out what the specific pathways were, the areas of priority in the workforce for each of those professions right now as it stands. We couldn't write every pathway, so these are just exemplars that are in the document, just so people can see what that could look like for an area of specialist practice or a sector. And you can see that the examples of each of those within each profession. Next slide, please. So these are examples of some of the domains, and there are 8 domains that go across all of those professions. And then alongside each of those 8 domains, there are 2 specific professional domains in addition. And those 8 domains were mapped across all of them, but the 2 specific professional domains, for example, in physiotherapy or occupational therapy or P&O, were derived from national stakeholder engagement that really pulled out what was important to the profession to ensure that the profession is driving across the pillars of practice in what they need to. And they were very different across each profession when we developed this. Some were 2 domains, 2 profession-specific domains in the clinical pillar. Some were actually in leadership. Some were in education. It really did change amongst professions depending on what that profession really needed to drive it forwards. They were also centre checked with all the professional bodies, and then also critical friends. I think we had something in excess of 30 critical friends and HEIs across the board. Next slide, please. And then there was developed pathways. So these are just an example from physiotherapy that we've taken here. And you can see there, again, when we did national workshops across the country, what we did was we brought people together across all levels of practice, across all provisions, and said, right, what is it that's important at this moment in time for your profession? What are the key drivers, you know, that are the big ticket items that we need to address? And like I say, these are not exclusive. So if you didn't see your particular pathway in this, these are just examples of how this could be. And one of the reasons we've done that is to really be able to visualize what this looks like at a pathway level, but also because this document needed to be agile. It needs to move as the professions move. So they're just examples of what these could look like, but it's not exclusive. Next slide, please. So we're now on to phase 2. We were really lucky and delighted to be engaged with the Royal College of Speech and Language Therapy, still with the same innovation partnership that Kim and I are leading from the University of Salford and Coventry University, to now deliver the same thing for speech and language therapy. So we have been engaging in national stakeholder events. Some of you here might have been to those events, and throughout those we've been looking and identifying what are the national priorities in speech and language therapy workforce. We will then start to look at that data that we've collected. We are starting to look and pull out and develop the curricular framework and develop that across the 4 pillars. What is important? How do those 2 new domains for speech and language therapy look? And then also think about those pathways and the profession-specific examples of pathways that you require. The other thing that we've been doing is gathering all the frameworks across all 4 pillars from speech and language therapy, what's already written, and what does this need to map to be inclusive of everything that is currently going on with your profession. And then it will also map across to the apprenticeship standard, so that the profession-specific curricula for speech and language therapy will nicely dovetail into the apprenticeship and map to all of those and all the professional frameworks. So it all ties up together. And again, if you look at that documentation, you can see what we mean from the ones that have already been written and landed on the NHSE page. Next slide, please. So moving forward, there are considerations, and these are just some of the things that we're just going to pull out. We've done this webinar now across a lot of professional bodies, and these are just some of the things that we're preempting the conversations or the questions that you might have and the thoughts that you might have. There's something around the difference between academic and practice level requirements. So one of the things that we've been looking at is the academic level, which would be at level 7. The standard, the apprenticeship standard, is written at level 6, but for any apprenticeship standard, you can deliver that to the level above or the level below. We anticipate for speech and language therapy, alongside a lot of the other allied health professions, that it will be delivered at level 7, because the workforce is already at level 6. So in terms of that, what we're thinking about is the level of practice and the level of academic requirements. When we talk about level 6, that would be our final year at an undergraduate degree. But equally, we might talk about pre-reg masters. So a pre-reg masters at level 7 wouldn't mean that you would then go on and be an enhanced practitioner or an advanced practitioner just because you had level 7 study. So there's a real difference in academic level and practice level. Yeah. Big opportunity to provide more structured learning for the largest part of our workforce. We know from the long-term plan and the workforce plan that we are struggling to maintain and get retention of the middle workforce, and one of the reasons for that is that structured career pathway we've had for a long time. The advanced practice level up here, and we've got the preceptorship, and we've had nothing that joins the 2 together in the middle. And it's really important, if you look across the water at medicine, for example, they have a really clear delineated career pathway, a really clear structure that they can move along. And it's really important as AHPs we provide that for our workforce. How are we going to operationalise enhanced level practice? It needs to be employer-led and collaborative across the university, so AEIs and employer-led, and they need to work together. It's really important that a university doesn't deliver this and develop this on their own. It needs to be what the workforce needs. So it's really important, and we've written into that documentation that this should be a collaborative piece of work. So are you liaising with a university to say, okay, what's your offering? How does that look for us? What do we need in the workforce so that we can develop that together? It's a real good opportunity for innovation to look at blended learning and work-based learning. And again, in the documentation, we've got a section on how that should look in terms of teaching and learning and what the opportunities are. what's mentorship, what's blended learning, what's work-based learning, and that's really underpinning this level of practice, really important. And CPD or credit-bearing learning, there's options here for people. It's not mandated because it's an endpoint assessment that's non-integrated. It can be that there's a CPD option. There might be a portion of the workforce who says, I really want to do structured CPD, but I'm not really interested in the assessment at the end. And that's absolutely fine. And that's part of an option of a route through this. Equally, there might be people who go, I'm going to do it and I want the credits, and I might want to think about maybe a pathway to looking at that for advanced practice. And this could be a route through to advanced practice, and Kim and I are currently still working with NHS England to look at what that looks like. So what is the transition between enhanced practice and advanced practice? And we're looking currently at developing what we'd call RPEL guidelines, so recognition of prior learning, and how that looks. And we're looking at how a PG cert could maybe could be recognised to add on to or moving towards that masters that you would need for advanced practice. And that information will be landing later on this year. Next slide, please. I think that's the last one. Yeah, okay. Thank you very much for listening, and thanks for attending the webinar, and we're now open to questions. Thanks very much, Will.
Just stop recording here as well, so everyone feel free to ask questions openly. So we'll just start that. And thank you very much to Claire, Kim and Louise as well so far. Thank you.